Welcome to the Michigan Medicine COVID-19 Vaccine Clinic. Today, we're going to give you an overview of what to expect when you come to Michigan Medicine to receive your COVID-19 vaccine. Before we get started, a couple of reminders. Vaccines at our clinics are by appointment only. In an effort to create a safe environment for everyone, visitors, including children, are not allowed in our vaccine clinics. Patients who require assistance may have a companion, including an interpreter, for support. At each of our locations, there are plenty of designated parking spaces for patients getting the vaccine. When you arrive at the clinic, our greeters will be on hand to ask if you have an appointment, ask if you're there for your first or second dose, and review a list of COVID-19 screening questions. If you have symptoms, have been exposed to a COVID-positive person in the last 14 days, or have tested positive for COVID in the last 21 days, we'll ask you to reschedule your vaccine appointment. If you're not showing any symptoms, you'll be directed to either the first dose or second dose pathway. Your next stop will be our check-in desk. Once you arrive, our staff will verify your name and appointment time and ask you a few additional questions. After you're checked in, you'll make your way to the line to wait for an open vaccination station. A volunteer will help direct you once a station opens up. At the vaccination station, your medical professional will verify your name and birth date so they can properly complete your vaccine card, explain which vaccine you're receiving, ask some additional screening questions specific to the vaccination process, and briefly discuss vaccine side effects and concerns. You'll then receive the vaccine in your upper arm, so be sure to wear appropriate clothing. If necessary, we have a private area on site where we can provide the vaccine. Before you leave the vaccination station, be sure to pick up a button or a sticker to help encourage others to get their vaccine. The CDC recommends an observation period after you receive the vaccine. 30 minutes for people with a history of immediate allergic reaction or anaphylaxis. 15 minutes for all others. Our observation nurse will direct you to a socially distanced seating area where you can set a timer and wait. If you have any issues with the vaccine, the nurse is there to help. While you wait, you have the option to schedule an appointment for your second dose, and we have volunteers on hand to help you. On your way out, you might want to stop by our selfie station to get a quick photo to mark the occasion. A couple of things to note. We have wheelchairs on hand for any of our patients who need them. We have iPads available to help with translation services. We have socially distanced seating throughout the clinic to stop and rest. We have volunteers throughout the clinic who are ready to help. Remember, you aren't fully protected until 1 to 2 weeks after your second dose. And to keep our community safe, you'll need to continue to mask up, wash your hands, and keep your distance. Every shot counts.